So after we've assessed the airway and are ensured that it's patent and that we've got plans, we've assessed the breathing and ventilation and we have adequate ventilation, and we've checked that the heart rate and the blood pressure are supported or will be supported during transportation, it's time to check on the disability. And this includes a neurological assessment, but also planning for the patient's comfort during transport as well. The minimum that we should be doing before we transport a patient is to assess pupil size, symmetry, and reactivity assessed and recorded. And this gives us a good baseline for when we're transferring the patient. That's especially important in somebody who's got a head injury. And by these clinical signs, we can see if somebody's deteriorating or not. The other thing that we need is a baseline GCS. And this gives us the ability to see if there's deterioration during the transportation as well. Also, we need to take into account that when your patient's being transported, especially if they're anaesthetised and ventilated, they're not able to protect themselves because they're anaesthetised and not able to move. So for this reason that we like to use some eye protection, so we'll tape the eyes shut. We may even use padding as well, and that helps us protect the eyes from any abrasions that may happen during transportation of the patient. Before we go as well, going back to patient comfort and also heart rate, we want to make sure that we've got any fractures or deformities stabilised. And this might simply be splinting, but it also might be a patient who's got a pelvic fracture and a long bone fracture, for example, who's been in RTA. It might be in the emergency department. We might need to stabilise that pelvic fracture with a binder, and we might actually need to put some sort of back slab onto the leg as well. Or sometimes we even take patients to theatres to put an external fixator on before transporting the patient. And that's so that everything stays in line when they're being transported. It shouldn't be too uncomfortable. Also, the problem is when you have an unstable fracture and it's moving, those bone fragments are going to start lacerating inside, and you've got the chance to cause more bleeding or lose more blood. And finally, we want to make sure that we've got the C-spine protected with a collar, or we may need to actually use some blocks to protect it as well before moving the patients.